Welcome back to New York Links. President Barack Obama gave a more definitive healthcare reform speech this week to a joint session of Congress. He dispelled all the myths that have been circulating by his opponents and adamantly stood firm on the issue of a public option. President Obama said, quote, "I will not back down on the principle. If Americans can't afford basic coverage, we will provide one with a choice," end quote. Zing TV was at a recent rally for the healthcare reform. Here's Gemma Tate with the update.
What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we want it? Now! What do we want? Healthcare! When do we...
I'm here at Times Square, gathered with 3,000 other concerned Americans who are out here to voice their opinions on the proposed health reform bill. Those who attended today's rally wish to shed some light on the pros and cons of the proposed health reform bill. Many like the idea that all Americans can have health care, due to the fact that millions of Americans are not insured or are underinsured.
All of the elected officials need to be fully aware of the fact that we are behind our president. We need healthcare reform because the current system is unsustainable.
I'm here supporting women's reproductive health as a part of healthcare reform in our country. I believe that women's health is primary health care, and I'm here supporting Planned Parenthood New York City in that endeavor. Right now, women's health is covered in the bill that exists, but I want to see it stay in for sure. I also am behind a public option, at least, for our country.
The crucial elements that are being requested are: 1, a public option, a public insurance plan that would offer an alternative to private insurance; 2, a single payer plan, a Medicare for All program in which government would provide insurance for everyone; and 3, fair consideration for immigrants as well as those with pre-existing conditions, among others.
Not only is it immoral, but it is public health stupidity not to provide health care to a person living with HIV, whatever paper they have or don't have in their hand.
Congresswoman Yvette Clarke has attended the rally today.
And when I cast my vote in favor of health care reform as a right, I will be voting for nothing less than all you New Yorkers deserve and expect. Healthcare reform for each and every one. Robust public option, and if we can make it happen for the state of New York, single payer universal health care from hence and evermore.
We intend to make sure that we flip the script, that preventative health care becomes a way of life in our nation, and that we become a much more resilient, healthy, and a nation that can stand tall among nations because it does right around its people. That's what today is about, and that's what I'm fighting for.
We also spoke to some concerned physicians as well.
It means I can prescribe medicines for my patients and not worry about if they can pay for them or not.
It's not only the people who want healthcare reform, but physicians as well across the country are behind this 100%.
I decided to get involved after hearing a lot of misinformation and blatant falsehoods about the current healthcare reform proposal. And just like Dr. Garcia said, it's incredibly important for Americans to realize that there are thousands of physicians who do support the current healthcare reform proposal, including the choice of a public option, because we believe it's really the only way that we can get all Americans insured and have access to quality, affordable health care.
Is your health insurance working for you so far?
My health insurance isn't working because basically I'm 20 years old, I'm in college. My mom pays $300 and something per month for insurance. I did surgery the other day and we still had to pay like a couple of $1,000. So it's like, it's worthless. So we need options, we need low cost health insurance. And really the only time that is available is now. There is no other time that's real. It's now or never. It's time for the healthcare reform. It's time. It's now.
And for you, Rachel?
No, my health insurance isn't working for me. I don't have options of which doctors they dictate, which doctors I can go to, which if I don't go to that doctor, I have to pay out of network. So I want options. I want reform for it. Should be a universal health care where everyone, no matter what your income or where your housing is, you should be able to go to doctors and you should be able to go to the doctor of your choice.
I have Medicare and I like it very much. It pretty well covers me, and because I was with the Board of Education. So before that, so I have like GHI and Medicare. So, but I'm concerned with my son, who is 35 years old and doesn't have any health care at all. He's worked for small businesses and he works very hard, and if anything happens, he doesn't have any coverage. And all the people like him that work for small businesses and the small businesses themselves who can't afford to cover the people that work for them.
Those who are opposed to the bill would like to see it revised to fit the needs of each individual's lifestyle. Additionally, the $1 trillion price tag makes numerous citizens uneasy because it's not clear who will bear the tax burden for such an expensive program that will result in an expansion of the health insurance industry over the next 10 years.
I don't understand why the whole system has to be changed to correct discernible problems in it. So I don't think there's a basic difference of opinion on people getting help, but how to pay for it. And we don't have any money right now. We're headed to serious deficits, and I don't think we can handle it.
The nation will know the final resort for Congress's ruling for this bill. They can only hope that the Obama administration will keep their best interests in mind once the legislation is set in place. This is Gemma coming from Times Square. See you next time from Zink TV.